My name is Brenda Waybrant. I've lived 8 years in Nashville and served downtown the majority of that time as a restaurant worker. I grew up in Kentucky and Michigan and attended public schools in both states. I was living in Kentucky when I moved to Nashville seeking better employment opportunities. I am one of many in the millennial generation who graduated college in 2008 thinking that my degree was the gateway to a good job. But the economic crash that year created a situation where there were limited opportunities for employment. I found work where I could, mostly restaurants and bars. I also did a stint in retail, barely surviving on minimum wage and with definitely no health insurance coverage. When I made the decision to move to Nashville, I had gone from no credit card debt in 2008 to being so far in the hole it was hard to see my way out. I started waiting tables at a downtown establishment and worked my way up the corporate ladder of that restaurant chain, all the while serving on the side because I couldn't afford to work just one job. When that corporate job ended last fall, the restaurant industry was there as a safety net, and I went back to serving downtown. But then in March, Tennessee had its first case of COVID-19, and I knew COVID was going to be a problem in Nashville early on. We're an international tourist destination, and our city depends on the revenue brought in by those tourists. The last shift I worked was March 12th, about 2 weeks before the shutdown in Tennessee. Business was slow, my hands were raw from washing them so often, and the mood was somber among the guests and coworkers that were there. This was before the mask mandates were in place in Nashville, and we didn't really know much about COVID yet. My last table on my last day was an elderly lady and her adult daughter from Seattle, Washington, a COVID hotspot at the time. I told my managers that I would tough it out at home and figure something out for a couple of weeks. After refusing to listen to the advice of health experts for weeks, Governor Lee finally issued a stay-at-home order near the end of March, and my establishment closed down. The stay-at-home order worked. It slowed the spread of COVID-19 into the early summer and bought Tennessee valuable time to address this health crisis. However, instead of using that time to get things under control like many other states, Tennessee squandered it in rushing to reopen the economy without a more cautious approach to slow the spread and by rejecting mask mandates. Over the summer, things got much worse, and my establishment is still closed down until October, when they'll open with limited capacity. I'm still furloughed until December 31st. I was grateful when the CARES Act was passed, providing critical support for hospitality workers like me who need help getting by while our jobs are on hold. I'm also grateful that my employer has allowed me to keep my health insurance while I'm furloughed, as long as I continue to pay my portion of the premium. It took 2 months for the state to approve my unemployment benefits, and by the skin of my teeth, I was able to continue to pay for my health insurance. It was a blow when the Senate refused to pass the HEROES Act, and I am worried about paying my bills. Since most restaurants don't offer health insurance, which I need, I just had outpatient surgery in August, I feel stuck receiving unemployment until my employer reopens at full capacity. I have a couple $1,000s in copays that I haven't been able to pay, and at this point, I honestly don't know when I'll be able to pay those off. I respect my employer's decision not to reopen until it is safe to do so. After all, what employer wants to be responsible for the public or for their employees getting sick, hospitalized, or worse, dying? Bringing workers and the public together without Governor Lee first addressing the health crisis is putting both workers and the public at greater risk of a disease for which there is no cure, no treatment, and no defense. And this kind of strain will lead to further, perhaps even worse economic devastation. The real issue is that President Trump and Governor Lee intentionally downplayed this virus from the beginning, fought with and ignored health experts, and then rushed to reopen things without a careful plan to contain the virus and protect workers, our economy, and our lives. And even though Nashville has a mask mandate, Governor Lee still refuses to issue a statewide mandate or a coordinated statewide plan, instead passing the buck down to county mayors, local employers to handle a global pandemic on their own. Governor Lee, we need a statewide mask mandate now. We need a coordinated statewide plan. I want to work, but I want to work in an environment that is safe for me, my coworkers, and the people that we serve. Tennesseans can't do their job until first you do your job. Get the COVID-19 health crisis under control so that we can safely get back to work.